Hi, today, as you can see, this sore throat with tender neck is quite basic symptoms that you will see every day in the family medicine. But this may not come out at what you expect, and I hope it may surprise you. And this is why I make this video. And as usual, we start with a case. We have a 22 years old student present with 3 days history of severe sore throat. He had developed a tender neck, rigors, increasing shortness of breath, and a permanent productive cough during the previous 24 hours. There was no past medical history, infectious contact, foreign travel, or intravenous drug abuse. On the physical examination, he was extremely unwell, and his temperature is 39.8 Celsius, blood pressure 100 to 50, and the pulse is 120. He had marked pharyngitis and tender cervical lymphadenopathy. His respiratory rate was 30, and there's a diffuse chest palpitation we can hear during the chest escalations, and the chest X-ray find there's a bilateral pneumonia, and the ultrasound of the neck find there's a non-compressible right internal jugular vein with no detectable blood flow. Before we move on to the diagnosis, so let's find out what are the critical things you must be aware. So firstly, always patient safe first. As you can be aware and also mentioned in the examination, this patient was extremely unwell, and his body temperature here is over 38, and then here is over 90, and here is over 20. If you're familiar with this one, you may already aware what kind of criteria I'm trying to um, mention. That is the criteria of systematic inflammatory response syndrome, SIRS, and this is one of the critical syndrome that um, you must target and then treat or relieve the symptom of this patient immediately. So, and then, but let's move on to other clues of how to identify what is the diagnosis of this patient. And this patient, he had a 3-day history of severe sore throat, and then those things and then his symptoms get worsening in short time during the previous 24 hours. You can already rule out those chronic disease such as like TB. As there's mentioned, there's no past medical history, infectious contact, and foreign travel. And then you may also rule out syphilis as pharyngitis, and then a young patient you may think of some sort of things like that, but it's too far, and you can also cross out. But then there are also others like group A streptococcal infections or EBV or other pharyngitis, but they are not like, especially in this age, this young patient is quite unusual to see the symptoms get worsened in this level. And then a tender cervical lymphadenopathy definitely also a very important clue. But what is the most important, most critical one is the ultrasound found a non-compressible right internal jugular vein with no detectable flow. It means there's something wrong in here, and then it rather by blood clot or rather there's some inflammation happening there. Considering of the young age of this patient is unlikely to be a blood clot, and he has no travel history, means he is not sitting in a long time, etc. And obviously it's not blood clot because he's having experiencing an severe infection. So we should think of the infection case. So we have the differential diagnosis here, but what is the one stand out from here? There is this pneumonia disease. Why? Because the most important characteristic of the disease is the inflammation of the right internal jugular vein, and And this is caused by the infection of Fusobacterium necrophorum. And I already put the full name on this in the description. If you're interested, you may look for it. And then, so what is the treatment for this disease is IV penicillium G, also benzodiazepine plus with metronidazole. So I find this one is not commonly seen in books. So I hope this sharing helps, and thank you so much for your listening.